To be honest, I felt a really strong anxiety during all that time. And at that point, when they told me that I should take care of my mental health, I was really desperate and couldn't believe that that's happening, that I didn't have understanding about infections. Even if I have some anxiety, that shouldn't be the main reason for infections. Hello, I'm Almina. I'm from Bosnia and Herzegovina, but I moved to Croatia recently, like 3 years ago. I'm going to share my UTI story with you. I hope this experience will be helpful to some of you. So I remember my first urinary infection about 6 to 7 years ago while I was living in Bosnia and Herzegovina. I was living active sports life, running, cycling, going to gym, and also eating healthy, like low carbs, high fat diet at the moment, and also working full-time job. I remember one night after a 10 kilometers run that I came home with some urgency that had to be like resolved soon. I had to go to toilet. So I had a really painful urination with some visible blood in my urine. I didn't know what happened, so I rushed to ER and actually emergency room, and they did some blood tests and urine tests, which proved urinary infection. So I got some antibiotics, sent home, and asked to take antibiotics and then see my family doctor, which I did. But fortunately, I didn't have another infection for almost a year. After that, I got another one, which also was really painful. I remember from the start, my urinary infections were really painful. I would have like some chills, and I would be tired prior getting real symptoms. But when I got the real symptoms, it was urgency, pain, and in general some discomfort in my around my urethra. Next time when I got infection, I again went to emergency room as it was a weekend again. Again, they did tests and say the same thing: do take antibiotics and go to family doctor. Unfortunately, after taking antibiotics, I got another infection in the next, I think, 6 months, and then it would occur even more often. When I went to my family doctor, they said that I have diabetes type 1 for 19 years and hypothyroidism for 17 years, and these are probably underlying conditions for my infections. At that point, I was thinking, that's okay, I will find a way to cure infections, and I didn't think much about it. When infections started to happen every 2 months, I noticed and I acknowledged that there is a bigger problem for me, that I cannot just continue taking antibiotics and just fight like that. So I explored a bit of the nose and also cranberry juice and some local herbal teas I could try. Also, I went to see a private doctor, which was urologist, and talked to them. They also did some tests, additional tests, recommended some natural remedies, same as the nose, and I just continued taking all these. However, it wouldn't help much usually. I would get another infection really soon. So at one point, they just stopped for maybe almost a year, and I was really happy, thinking that's it. I got rid of all these infections. I didn't do anything special at that point. Just drinking a lot of water, taking nose, cranberry juice, trying to living good, healthy life. So 3 years ago, I moved to Croatia. It was a nice life event, and I moved here. Soon after that, I got another infection, which was really painful again. And unfortunately, again, I say unfortunately because it was really difficult path for me. I would get another infection every month or even after finishing antibiotics. I noticed that intimacy with my husband sometimes triggers infection, and some stress was also a trigger for infections. I was completely lost and tired of all these infections that occur one after another immediately after finishing antibiotics. When I went to family doctor here, she prescribed me, I got prescription for a urology clinic in capital city Zagreb, as they were the best hospital to actually investigate my underlying conditions and connect them to the urinary infections I have. So I went there. They also did some tests, but said that chronic infections are like that, and that I need to take antibiotics, like small dose of antibiotic for the long time to try to cure the infection. I tried that also. I was taking some antibiotic for 6 months, like small dose, but during that time I would also get acute infection. I also tried, with help of the private urologist, I tried the high dose of antibiotics for the 4 months. That also didn't help me much. I would get infection even then. So I got prescription for another hospital now in the city where I live, to go to urology clinic and do some tests there. They did another palette of tests, like it was gynecologist test, it was test for the cytology test for my urine to check if it's like there are some bad cells such as cancer cells and so on. It was like big amount of tests they did. All tests were good and didn't show anything that would be underlying condition for my infections. I remember one day when I went to urology clinic again with the infection, and they told me that I should take care of my mental health instead of just focusing on infections. To be honest, I felt a really strong anxiety during all that time. And at that point, when they told me that I should take care of my mental health, I was really desperate and couldn't believe that that's happening, that I didn't have understanding about infections. Even if I have some anxiety, that shouldn't be the main reason for infections. They didn't know that I already started with some antidepressants for my anxiety, but that didn't stop infections to happen. So, really bad place. I felt really weak, really lost, and without any help. I went to Google some things. I found the Live Duty Free website and community. I also find some other groups which helps, like social channels that help people with the urinary infection, at least with support. As we name these infections as chronic infections, it's really evident how hard it is to cure them. There I met some girl who told me about her journey with urinary infections and how she tried methenamine and hippurate and how she tried Chinese herbs with the Chinese medicine doctor. I did try with the methenamine and hippurate, but it was, I think, the worst point for me, as that didn't help immediately because I had really acute infections. And then I also tried Chinese herbs for a few months, but I stopped taking everything and I was really desperate. I asked for more antibiotics just to cope with the pain and try to resolve infections. As that didn't work, I got back to the girl I met and asked more details. I also went to Live Duty Free and read all articles, read all testimonies about all experiences from other folks. So I decided to stop taking any antibiotics because they didn't help actually. And I went and scheduled a meeting with Chinese medicine doctor. I talked to him and he assured me that I should still take antibiotic when needed, but start taking Chinese herbs, which should help me, but in the few months I should feel the first relief. I decided to be really patient this time and not to lose the hope for that I'll be cured from the infections. So at that point, I started taking Chinese herbs, methenamine, hippurate, and occasionally, let's say in 2 months, I would take antibiotic if I had acute infection. Also, I asked my gynecologist to prescribe some estrogen cream, as that was also recommended from the Chinese medicine doctor, as he looked into my hormone results. So I got everything and started taking everything every day, just following all routine. And luckily, last year I had only one infection, which was really mild. But I decided to take antibiotics as we were moving to another place. It was really stressful for me. I wasn't sure if I'm going to take all like herbs and methenamine hippurates on time. So these are things that really helped me, and I never felt that good and positive after like my first infection happened. So that's basically my journey. I would say that you need to look for the things that works for you, to try them, not to stop like after like a month or two. Just try it, believe in a cure, and also investigate, search, fight for yourself, advocate for yourself at any place. The good thing that I want to share with you that here in Croatia, urology doctor told me that methenamine hippurate is actually recommended by the European urologist to be used for the chronic infections, but they still didn't have it in Croatia. I had to buy it from abroad. Also, my family doctor asked me to share all things I did to help to improve my condition. So I shared with her like Chinese herbs, path, and Chinese medicine doctor. Please do only check the doctors, approved doctors to work with. So I shared that with her. I also shared about methenamine hippurate. I shared the fact about estrogen cream. So that was my path to recover. If you ask me what helps the most, I'm not sure. Really, I'm not sure, but I'm still taking only Chinese herbs once per day, and I'm taking methenamine hippurate every 2 to 3 days. If I feel that something is coming, you know that we're always afraid of new infection, even if it's maybe not there, but feel some symptoms. I just introduce methenamine hippurate again for every day and increase the amount of herbs I take. And yeah. That's all what I have to share with you. I wish you all the best, and I wish you all to feel better and recover well. Thank you. Bye.
Hi, I'm Jenka from Love. I hope you found this video helpful. There's no single approach that will work for everyone when it comes to health, so I invite you to watch more patient videos here or read more stories over on our website, liveutafree.com, and take what resonates with your journey. Remember, it's always best to consult with a clinician before trying something new. If you'd like to share your own story, please get in touch. Our info is in the description. And feel free to reach out with any question about patient stories, finding a clinician, or your own personal experience. Also check out the description below for more helpful resources. If you find these videos valuable and would like to support what we do, don't forget to subscribe and hit the bell button to stay updated when we post new content. Thanks so much for watching and for being part of this community, and remember, your story matters.